Thanks for tuning in to Health Advocates Ask the Expert series, our monthly show about trending topics in healthcare. I'm your host, Courtney Preiser. Today we welcome back Matt Verdecchia, a senior trainer with Health Advocates Employee Assistance and Work-Life Program, to discuss how health and benefits are specific to colleges and universities. Thanks so much for being here.
Oh, it's my pleasure. Thanks for having me back.
So just to start with, can you talk a little bit about how higher ed institutions differ when it comes to their health and benefits? What are some of the key issues that they face specifically?
With higher education, I think what we're starting to see is they're beginning to add more wellness programs. They're starting to provide benefits to part-time employees. So I think we're starting to see a trend toward that, of which some businesses had done for years ahead of time. I think too, though, and more importantly, there's a cultural difference between organizations as a whole and those that provide higher education. Part of those differences, I think, one are the cultural difference in terms of whom they serve. Their customers are students. Their customers are families who have much higher expectations, I think, than organizations in general. I think you also see that there are differences in the environment on a college or university campus. I think there are more stressors, at least, that students perceive that are occurring around them, and rightfully so. We see a lot of things in the newspaper that they have to act and react to beyond just being away from home, beyond just spending their money wisely on an education, and beyond just acclimating to a completely new and different environment.
So then what are some of the resources that are typically available for the faculty and staff component of the population?
I think similar to those that are offered in general organizations, colleges and universities provide support through external agencies, understanding that people have setbacks and there are resources that might be necessary to help them with personal and professional setbacks. There are also obviously peer organizations that assist them. On-site services, whether they're medical, whether they're psychological, ongoing training and education, I think are part and parcel in an education setting. Certainly then for students, when you take a look at what's available to them, again, going through the various differences and stressors that they have, the nice thing that we find is students are much more likely nowadays to look for resources. They're comfortable in identifying that they might be having difficulty acclimating to an environment away from the house. They're comfortable telling their friends that they might have an anxiety or a depressive disorder. They have more ease of telling, or at least recognizing, that they might be experiencing bullying in the workplace, potentially violent situations, or drugs and alcohol, obviously. So services need to be provided not only to the organization in higher ed and those teachers, faculty, but you have to provide those resources to the students.
They're seeking them out and expecting them.
They have a high expectation that those services are going to be available.
Absolutely. So how does integrating then both sides, both the employees and the students, benefit both groups?
Having an integrated part, whether it's resources that provide support strictly for the employees of the university and their dependents and the students there, having it all under one roof, having maybe one toll-free or one place to go with various modes of entering into that resource. It could be video counseling, it could be telephone available, it could be in person. And not only providing those resources, but providing support to the resources that are already available on college campuses. Obviously, there are counseling centers, whether they're actually on-site or in the community. We can partner with those organizations to help make them more robust. We can make them a 24-hour service, where in the past they might have only been available from maybe 8 to 8 or 8 to 9.
Which isn't always good for students.
Which is not always good for students and or faculty. Faculty are not one who are going to go out and say, hey, I need assistance. But they might call an objective, confidential resource to help them manage. Or they might reach out to a confidential resource and say to themselves, hey, you know what? I have a few students I'm very, very concerned about. I'm not really sure how to help them. So having that objective resource to help students and administrators help normalize those issues.
Absolutely. So then how is Health Advocates' support of colleges and universities different from what else is available out there?
I think part of it is the education component that we put out there. We want people to take advantage of the resources that we provide, whether it's employee assistance programs, whether it's student assistance, and then managing that with a core medical advocacy. Students are no different than adults. They're just different ways of managing those situations. So when they recognize that they have an issue and have a resource to go to get assistance for it, I think that's definitively how we differ. We talked about training. We can assist with RAs. We can assist with their security team.
Sure.
We can help them in putting together a threat assessment team. And I don't mean to sound all kind of dark, but I mean, we're experiencing, or young adults on college campuses are experiencing things that we didn't grow up with.
It's true.
And I think it's important we provide resources for both ends of that spectrum in a college or a university.
Really address the entire campus population.
Yeah.
That's great. Well, thank you so much for being here today.
No, it's my pleasure. Thanks again.
Thank you for joining us. We hope you like what you just heard, and if so, you can subscribe to our channel or follow us on our social media pages below. And join us again next time for another edition of Ask the Expert.